Well, hello, it's Bruce Williams again, and today I want to present part 6 of my series on the selected gross pathology of the dog. And we're going to talk about pathology of the skin. And this is a great example of why these lectures are the selected gross pathology. This particular lecture, I'm not going to try and cover dermatopathology in any form of completeness, but instead try to show some good images of some classic lesions. The gross pathology of the skin uses the same terms over and over again. Alopecia, hyperkeratosis, and necrosis come up over and over, and it shows the magic that dermatologists, God bless them all, do, taking a look at these lesions, which often give a large differential diagnosis and drilling down to appropriate treatment. Another thing that I want to mention right up front, I've never had a skin biopsy, with the exception of some of the tumors, that didn't benefit from a good gross picture. Encourage your contributors to submit gross pictures of lesions because they're very often extremely helpful. And everybody has cell phones now, so there's no excuse not to be getting pictures. Before I start, I want to thank the contributors to this particular lecture and that of the series of the dog, and I certainly couldn't do it without them. I'm going to single out one contributor for this lecture, Dr. Fabrizio Grande. Many of the images, if not all the images in this lecture, are available through Noah's Archive. Dr. Grande has taken the time to upload outstanding dermatology images from his contributors and to provide great explanations. So if you're looking for good dermatology images, look no further than Noah's Archive. Okay, let's start, and I generally like to start most of these mini lectures with infectious diseases. And here's an infectious agent that causes this proliferation of papillomas on the skin, especially the abdominal skin. We covered this particular virus or a closely related virus in the lecture on the oral cavity. These are papillomas, especially inverted papillomas, which are caused by canine papillomavirus, often seen in larger numbers in animals that are immunosuppressed. They generally are firm, umbilicated masses, and they often pop up on the ventral abdomen or areas where the skin can be macerated and scraped, and papillomavirus can infect the skin. If we look very closely at these lesions, here's one that's cut in cross-section, and you can see why it has an umbilicated surface. The tumor goes down into the skin, and you see these fronds of skin within them. The virus infects the basal epithelium. It propagates within the stratum spinosum, forming chorocytes, or very large bluish-gray keratinocytes, because of an accumulation of intracytoplasmic keratin filaments, and the nuclei will occasionally, if you're lucky, contain 1 or 2 eosinophilic viral inclusions. Not every chorocyte will have intranuclear inclusions of papillomavirus, only a rare few. So it's a good day when you see one. Here's another lesion that can be caused or at least has been associated with papillomavirus. And these are viral pigmented plaques. Canine pigmented viral plaques are uncommon manifestations of papillomavirus. They can be one or multiple, slightly raised with a rough surface, and usually become stable over a period of time. Every once in a while, like many papillomavirus lesions in other species, they may undergo malignant transformation to squamous cell carcinoma, canine pigmented viral plaques. Here's a classic lesion, focal alopecia hyperkeratotic dermatitis. See, I'm going to use those terms over and over again on the ear of a dog, a round lesion. It's crusty, it's white, and this is classic for dermatophyte infection or ringworm. Microsporum canis, a zoophilic form of ringworm, which is transmitted from animal to animal, is the most common, of course, in the dog. There are also geophilic forms, which come from the soil, including Microsporum gypsum, and anthropophilic forms, which may be transmitted to people, including Trichophyton rubrum and Trichophyton meningrophytes, variant interdigitale. It's usually seen in young animals and can be seen in immunosuppressed animals. And don't forget to check the owners for spread of some of these forms of ringworm. It's a lot bigger problem in pet cats, which we'll see in the lecture series on lesions of cats. When we think about other fungal infections of the skin, all of the dimorphic fungi can appear as cutaneous nodules and may accompany systemic lesions in the dog. Blastomyces dermatitis, Histoplasma capsulatum, Cryptococcus neoformans or other species, Coccidioides immitis. All of these are classic lesions and where we can see skin manifestations of systemic infection. This particular case is from Brazil, and down there sporothrix is much more common than here in the United States. It's a little farther down on my list than the US, but in certain parts of Brazil, in which has become endemic, it commonly affects cats and gets in the soil. People can get infections. I think sporothrix goes much more on the list, but if you were to ask me which fungus, I would just have to give you a differential diagnosis. Sporothrix is one where you more commonly have cutaneous lesions than systemic lesions, as in some of the other dimorphic fungi. This is one where it can be somewhat difficult to find the yeast-like organisms, as opposed to something like Cryptococcus or Blastomyces or even Histo, where they're fairly prevalent. We will certainly talk about Cryptococcus when we get to lesions of the skin in cats in a subsequent lecture. Another infectious agent, which we don't see too much here in the United States, but is very common in other parts of the world, which affects the skin of the dog, is Leishmania species. There are multiple species of Leishmania which can result in cutaneous and systemic infections. And alopecia of the face is a common presenting sign, although it can get much worse than that. And this poor animal has been diffusely affected. Once again, alopecia, hyperkeratosis, some ulceration, but a severely affected animal. Leishmania is not a difficult diagnosis to make. It can be readily viewed in macrophages. It can be seen on most biopsy samples. And in the biopsy, it is characteristically associated with numerous plasma cells. These are chronic infections. Leishmania has to be a consideration, a differential diagnosis for these types of cases of alopecia and ulceration in certain parts of the world, including South America and Southern Europe, and is an emerging disease that those of us working in the United States need to be on the lookout for due to the global traffic of pet animals. Going back to this particular case, I would have a nice differential diagnosis for this case, something that we do see in the United States, and that is dermatitis. Canine dermatitis is seen in young animals, often seen in immunosuppressed animals. Everybody has a little bit of Demodex on them, every dog, every person, but animals that have a poorly functioning immune system will have more severe infections. Now, one of my differential diagnoses for this presentation is also going to be something that looks very much like this. Okay, now we're going to move into the immune-mediated disorders, which are a common differential for many of the hyperkeratotic or necrotizing lesions that we see in animals. This hyperkeratotic and crusting appearance of the face is very characteristic of Pemphigus foliaceus, although you can see it in other parts of the body as well, including the foot pads or the groin. It's often a bilaterally symmetrical presentation with thick crusts, which are preceded by transient pustules. These pustules are superficial, they are intraepidermal, so within the corneal layer you will see large aggregates of viable and degenerate neutrophils with occasional free keratinocytes, which are known as acantholytic cells. It's the most common form of pemphigus in domestic animals and usually occurs in middle-aged dogs. It's considered to be a spontaneous disease in some breeds, including Akitas and Chows. It can be drug-induced in some breeds, such as Labradors and Dobermans, or it can be associated with animals with chronic allergic or pruritic skin disease. So crusting of the face, the ears, and nasal planum, immune-mediated disease, especially Pemphigus foliaceus, needs to be a consideration. As we said before, it's not solely confined to the face, but it's a middle-aged dog. There are extensive crusts, and biopsy of these lesions is paramount. Make sure that you get a good picture of the animal, and you're going to be looking for these pustules with acantholytic cells. Here's an absolutely fantastic picture of those transient blisters or pustules that will appear as the acute form of Pemphigus foliaceus. And on this one, we do have the groin lesions that have been described. Okay, this is a presentation that you probably won't often see. Most of them will be the crusting lesions that we've seen before. As we always talk about differential diagnoses, a couple of possible differentials that you would see for Pemphigus foliaceus, which is the one that is the most obviously derm, does not generally affect the mouth like you might see with Pemphigus vulgaris, would include, in this particular picture, bullous impetigo. This is usually the ventral abdomen in young dogs, and other forms of bacterial folliculitis. Impetigo usually doesn't affect the follicles, it affects the skin, whereas, of course, bacterial folliculitis, you are going to see an attack on the follicles and neutrophils down within the follicles. You won't see the acantholytic cells, however, in folliculitis that you will see in Pemphigus foliaceus. As we go back to this lesion, I think that you probably, if you were talking about the autoimmune diseases not affecting the oral cavity, probably also need to consider Pemphigus Erythematosus. That's a milder immune-mediated disease. The lesions are not severe, and it primarily affects the face, leaving or sparing most of the rest of the body. One of the most common, if not the most common, diagnosed autoimmune diseases of the dog, which give us skin lesions, is cutaneous lupus erythematosus. Historically, lupus that was restricted to the skin was called discoid lupus erythematosus, but the term cutaneous lupus erythematosus is now preferred, as discoid lupus erythematosus comes to us from humans, and the lesions are not exactly similar. Cutaneous lupus erythematosus refers to the skin-specific effects of lupus. Remember, lupus may be a systemic disease, and which has cutaneous manifestations. You should know, however, that cutaneous forms may not precede the onset of systemic lupus. Most of these animals probably should be tested for systemic lupus. The lesions generally arise from type 3 hypersensitivity reactions, and in systemic cases, in addition to the skin, will often infect the joints and the kidneys. Getting back to the skin lesions, there are a number of well-defined syndromes in various breeds, including vesicular cutaneous lupus erythematosus, which is seen in rough-coated collies and Shetland sheepdogs, as seen here. Other breed-specific syndromes include exfoliative cutaneous lupus erythematosus in the German short-haired pointers, disseminated discoid lupus erythematosus in Chinese crested dogs and Spitz, and mucocutaneous lupus erythematosus in German shepherd dogs. The lesions of lupus generally affect the poorly haired areas of the face, including the nose and the lips and the tips of the ears, the limbs, and may also be seen along the ventral abdomen, the axillae, and the groin. Histologically, on biopsy, if you get a good one, you'll see a lichenoid interface dermatitis with a predilection for lymphocytes at the dermo-epidermal junction. Hydropic degeneration of basal cells with pigmentary incontinence. And finally, a very characteristic finding of apoptosis of basal cells, which is known as Savant bodies. Another disease of collies and Shetland sheepdogs, which can resemble cutaneous lupus erythematosus, is Canine Dermatomyositis, which affects many of the same areas, often the bridge of the nose. And this is a vasculitis, which results in atrophy of the overlying muscles and degeneration of the skin. You'll see on biopsy marked basal cell necrosis and vesiculation at the dermal-epidermal junction. And all of the underlying adnexal elements will be atrophied and thinner than normal. There are a number of these vasculopathies which share similar signs, including juvenile onset ischemic dermatopathy, and one of my favorites, vaccine-induced ischemic dermatitis. This can result from vaccination. We used to see it with rabies vaccines. Saw it a lot in poodles, and we used to call it, in practice, we used to call it poodle patch. It was almost always in white poodles for some reason, and the vaccine would cause a vasculitis, and then you would have loss of all the and atrophy of the overlying adnexal elements and hyperpigmentation. Always the white poodles, okay, because it would really stand out. Here's another condition of dogs that probably is not related to cutaneous lupus, but it has lupoid in the name. And this is a great picture by Dr. Donald O'Toole of lupoid onychodystrophy. And probably it's not a dystrophy. Lupoid onychitis would be a better term because it's really an inflammatory lesion. And what you will see is similar to the other diseases we've recently described, with an interface dermatitis at the nail bed epithelium with basal cell apoptosis. Now, the problem with this particular condition is that you need a biopsy of the nail bed, and normally all you get is sloughed nail, which doesn't have any viable epithelium. Another reason why pictures are so important, because it's a very nice, gross diagnosis, especially because the biopsy we get are usually substandard for this particular condition. Most of the cases of lupoid onychitis are idiopathic, but like so many of these autoimmune-mediated diseases, adverse reactions to drugs or food have been indicated in many cases. Well, let's cover a couple more of these autoimmune diseases. As you can tell, they certainly start to run together and look alike. Alopecia, ulceration or necrosis in the early stages, maybe some vesiculation, then oftentimes what we get is the crust. This one is hereditary epidermolysis bullosa, and it's almost always seen in puppies. So that might be helpful. It's a skin disease that usually affects these animals between birth and 2 months of age. Epidermolysis bullosa is generally a defect of the basement membrane. So biopsy will show a split with a loss or a separation of the epidermis from the underlying dermis. And most of the information that we get on these diseases still comes from human, where a number of components of the basement membranes, including laminin and integrin, have been identified in affected people. Hereditary or inherited EB, epidermolysis bullosa, because it's usually seen in very young animals, may be a easier diagnosis than some of these more chronic diseases. These next two lesions are sort of fun lesions. They're not very common. They also have to do with vascular damage. This first lesion, which is a characteristic lesion that affects the distal tip of the pinna, goes by the name proliferative thrombovascular necrosis of the pinna. A characteristic lesion, and if you touch these are fairly painful. The thrombovascular part of the name comes from the effect that small arterioles in this area undergo fibrinoid necrosis, which you can see in the biopsy. You often don't get biopsies on these. It's a very characteristic lesion. You may, however, get an excisional biopsy, which also can provide a surgical cure. The proliferative part of the name comes from a proliferation of small arterioles, as well as extensive dermal fibrosis and inflammation. Vasculitis is not really a part of the, aside from fibrinoid necrosis, inflammation of the vessel walls is not really a part of the biopsy feature. Another lesion, which primarily affects large breed dogs, including St. Bernards, giant schnauzers, and Newfoundlands, is another arteriopathy. It's a proliferative arteritis where the small arterioles of the nasal planum, especially the nasal philtrum, become proliferative with spindle cell proliferation within the lumen, with expansion of the wall, with extensive mucopolysaccharide deposition, resulting in ischemic necrosis of the nasal philtrum. So this is proliferative arteriopathy of the nasal philtrum. We are almost done with all the inflammatory diseases, and one that if you're in practice you will see on not an infrequent basis is one that you see in puppies. And we used to call this puppy strangles because of the tremendous swelling of the face. But unlike equine strangles, it has nothing to do with bacteria. And so unfortunately back in the day we would pump a lot of antibiotics to no effect in these animals. Today the pathogenesis of this is better understood. It has been renamed juvenile sterile granulomatous dermatitis. And they're much better treated with mild doses of corticosteroids. There is a sterile pyrogranuloma syndrome in older dogs. It's much less common. And any bacteria or bacterial infection that's seen in these dogs, like pyoderma, is secondary to the primary process. These animals also may have joint pain and might have a shifting leg lameness, but it's an immune, basically an inflammatory disease, non-bacterial, and best treated with some form of immune control. Here we're looking at bilateral truncal alopecia of a Pomeranian with extensive lichenification and hyperpigmentation. And this is a group of diseases which are now lumped under the name Alopecia X. This would include growth hormone responsive dermatosis, castration responsive dermatosis, hyposomatic tropism, and estrogen responsive dermatosis. These animals are not hypothyroid. They are not hyper cortisolemic, so they don't have Cushing's, they don't have hypothyroidism. It's usually small breed dogs, and it's thought to be some sort of dysregulation of adrenal hormone synthesis. In some cases, a partial deficiency of 21-hydroxylase, which is required for proper production of progesterone and androgen. In a lot of these, look for, on the biopsy, look for flame follicles or tricholemal keratinization, which helps you put, along with the breed predisposition, put it in this particular classification. Once again, so many of these are predicated on getting a proper biopsy and hopefully an image of the animal to get you to the right diagnosis. Okay, let's just go into some fun ones. Here is this sort of greasy proliferation of hyperpigmented skin, which is often seen in dachshunds. This is a condition which has been known as acanthosis Nigra Cancer. It doesn't seem to be a predisposing cause. It usually starts up in the axilla. You have first alopecia, lichenification, then this proliferation. These are usually sort of greasy nodules, and it's identified in animals starting around the age of 2 years. Going forward, sort of a dachshund thing. Paw pads, bad crusty paw pads. This is from my friend Dr. Claudio Barros in Brazil, and this is a lesion we don't see much in the U.S. anymore, but you can still see it, and you can see it in other parts of the world. And this is the hyperkeratosis of the paw pads, which is unfortunately the result and one of the classic lesions of canine morbillivirus or canine distemper. You can see crusty paw pads in old animals of all types, but there are a number of conditions which result in hyperkeratosis of the paw pads beyond canine distemper that we need to think about. One of these is going to be zinc deficiency, and there are a couple types of zinc deficiency that are worth noting. One is that which is seen in Malamutes and Huskies, because these breeds have an inherited defect in absorbing zinc. And a lot of times you don't see it until they're stressed, maybe they're pregnant, or they have concurrent diseases. And you'll see it on the foot pads, you'll also see it on the face, around mucocutaneous junctions and pressure points, such as the elbows and the knees. Okay, the good part about this is that you can supplement these animals and they'll do fine. You also will see hyperkeratosis in these areas in animals which are rapidly growing on a low zinc or high calcium diet, because calcium will sort of compete with the absorption of zinc. It's known as generic dog food dermatosis, usually seen in poorly formulated, poor quality dog foods with a lot of soy or cereal, which also interferes with zinc absorption. Once again, responsive to putting them on a higher grade of food and possibly supplementing with zinc. The one that you will see in a particular breed of dog which has a non-responsive zinc deficiency is a condition known as lethal acrodermatitis in bull terriers. And these don't respond to zinc administration. The disease starts early in life, between 6 and 10 weeks of age. In addition to this hyperkeratosis, which is the least of their problems, they have an exfoliative dermatitis and a T-cell deficiency, and they usually die as a result of severe immunosuppression, often due to bronchopneumonia. And these animals' copper levels are also very low. And then the one final disease that was identified by Dr. Bob Dunstan back in the 90s that everybody loves to see and loves to talk about because it's such great lesion, are the hyperkeratosis of the paw pads as a result of a condition known as hepatocutaneous syndrome, although it can also be seen in severe pancreatic disease. Initially, it was thought to be the result of a glucagon-secreting pancreatic tumor, but now it's been linked to a number of other chronic diseases of the liver and, to a lesser extent, the pancreas. The entire pathogenesis has not been worked out, but is thought to be the result of improper metabolism of glucose and amino acids, usually due to severe liver disease. It may be seen in addition to hepatic cirrhosis, hepatic tumors, and also zinc and fatty acid metabolism has been thought to be sort of balled into it, which links it back to your zinc deficiency diseases. The classic biopsy is the red, white, and blue sign. Okay, so you can rejoice if you're from the U.S. or you're from other countries like France, because those are the colors of your flag. But everybody remembers there's the red, white, and blue sign, the red, and this will be the only histo picture I put in this lecture. But and I don't like to have histo in my gross lecture, so I'm making a big exception because this is such a great picture. But this is the red band of hyperkeratosis, parakeratotic hyperkeratosis. Remember, parakeratotic has the nuclei in there. Orthokeratotic is the more normal basket weave, which shouldn't have nuclei. So band of thick parakeratotic hyperkeratosis. The layers of the stratum corneum corresponding to the granulosum and the spinosum are white because of intracellular edema. And then finally, there's proliferation of the basal cell layer, which gives it a very basophilic appearance. So that's your red, white, and blue associated with hepatocutaneous syndrome. Now, hepatocutaneous syndrome in its early stages will affect the paw pads, but here is a picture of an animal with an advanced case, and this is obviously affecting the paw pads, but is going up to the skin of the extremities, What a terrible mess and a sad case of hepatocutaneous syndrome. Okay, another really interesting and cool disease that dogs share with people, and also a couple of other breeds such as cattle and sheep, is cutaneous asthenia, also known as dermatosparaxis. And this is an autosomal dominant collagen packing disorder or collagen dysplasia in dogs. And basically, their skin is extremely stretchy due to the lack of collagen. It's also very thin. It tends to tear very easily, and they will develop other conditions such as hygromas because it's a collagen defect. So they'll get these hygromas, they'll have joint laxity, and there'll also be ocular abnormalities. The precise biochemical defect has not yet been identified in dogs. There's like a dozen different types of Ehlers-Danlos in people. And to my knowledge, the only species in which it has been definitively identified is in cattle, where it resembles type 7 in people. But they do get it, and this is a very classic test for Ehlers-Danlos syndrome, which it doesn't look like this animal's enjoying very much. But if you can take the skin and you can pull it up like they're doing here, and the height of that skin measures a quarter or more of the nose to rump length of the dog, supposedly that is a diagnostic test for Ehlers-Danlos in the dogs. I think that the presence of the hygromas and all the tears in the skin really help, and I would be afraid to tear this skin. But that's the way that you're supposed to do it. On biopsy, it's very subtle, and it's often very difficult. People will send you the biopsy and say, is this, Ehlers-Danlos or cutaneous asthenia? And you're looking at it, and you run a massage and try to characterize the collagen, but you never get an age-matched control, so it's a very difficult microscopic diagnosis. And even taking these cases to EM, as we do from time to time, just is not terribly rewarding. So I think that maybe this stretchy dog test might be the best way of diagnosing it, better than sending off a biopsy. Oh boy, we said we're going to use a lot of terms like alopecia, and this is a pretty bald dog. But this particular dog has a syndrome that we see in people. It has a syndrome that has been seen in cattle as well. This is an X-linked disease called ectodermal dysplasia, in which you have defective formation of hair follicles and teeth. Animals may be anodonic or hypodonic. This particular animal has some enamel dysplasia, so something's going on in the teeth. He is partially haired, but ectodermal dysplasia. Okay, here's a dog who has hair, but patches of hair on the face and on the nasal planum and patches of skin on the nasal planum have progressively gone white. And this is canine vitiligo. It is not that different than what we see in certain breeds of cattle or in people. It's an acquired discoloration, coloration abnormality due to progressive loss of melanocytes. It appears that it may be heritable in some breeds of dogs. It generally doesn't cause any type of inflammation, which is important to differentiate vitiligo from this particular disease that's often seen in Akitas, Chows, or Huskies, which is accompanied by marked infiltration of affected areas by macrophages. This is a condition which is now known as uveo-dermatologic syndrome. I learned it as Vogt-Harada-Koyanagi syndrome, and I was always proud that I could pronounce that and spell that correctly. You also will see depigmentation, leukoderma, which is the skin going white, and leukotrichia. But this particular condition is an immune-mediated disease resulting in sensitization of macrophages to melanin pigment. It is usually associated with ocular lesions, which often come first. You can see this particular eye has anterior uveitis and corneal edema. In humans, there's often an associated meningoencephalitis, which we do not see in affected dogs. But there is ulceration of the nasal planum. There, in biopsy of this will show, or evaluation of the eyes and autopsy will show massive infiltration of macrophages, which often contain melanin pigment. This particular dog looks especially worried that he will develop this condition in the future. So this is uveo-dermatologic syndrome, granulomatous dermatitis, and uveitis as a result of sensitization of macrophages to and the macrophages in the skin biopsies will be located at the dermo-epidermal junction, and there will probably be significant pigmentary incontinence. Color mutant alopecia. That's another hereditary skin disease. We see it in a number of breeds, especially Doberman pinchers. Blue and fawn Dobermans, not the black ones, the blue and fawn ones have between a 60 and 90% incidence of this. So the disease is limited to the areas containing color-diluted hair, meaning the sort of black or brown areas on these particular breeds. It's usually bilaterally symmetrical. It's often truncal, and these areas tend to have a very thin, poor quality hair coat and multifocal areas of bacterial folliculitis. You can also see it in Yorkies as well. So color mutant alopecia. The most common endocrine skin disease of the dog is the one that's associated with hypothyroidism. It's probably also the most commonly overdiagnosed endocrine disease in dogs. True hypothyroidism occurs most commonly in middle-aged dogs, doesn't have any sex predilection, and there's many breeds that are associated with it, including Shar-Peis and Chow Chows and Great Danes and Bulldogs and Dachshunds. Just about any breed can develop hypothyroidism. Remember that thyroid hormones stimulate the anagen phase or the growth phase of the follicle. So in hypothyroidism, most of your follicles will be in the telogen phase. There will be many empty follicles. These telogen follicles, they lose their hair shaft very easily. And because the animal's hypothyroid, they're not going to go back in and develop new hair shafts. You may also see a number of secondary problems, including seborrhea, because thyroid hormones influence the fatty acid concentration of sebaceous glands. And this form of dry seborrhea will predispose the animal to secondary bacterial or yeast infections. So there's a lot of secondary dermatitises that are associated with hypothyroidism. Another finding that you may see in biopsy of this skin is myxedema in severely hypothyroid dog, or an increase in the glycosaminoglycan concentrate, which may show as separation of adnexa and cutaneous elements by a sort of bluish material. So that's myxedema. The face of, and I showed you in the endocrine section, the face of these these dogs may have myxedema, giving it what's been referred to as the sad or tragic face of hypothyroidism. They tend to be cold a lot of the time. We can contrast that with a Another very common endocrinopathy in dogs, and is hypercortisolism or Cushing's disease. The cutaneous manifestations of Cushing's disease in the dog most commonly start over the neck or the back of the dog, and you will see thinning of the skin, which will result in increased bruising, tearing of the skin, decreased wound healing, increased infections, comedone formation, and then ultimately you will get the deposition of mineral within the skin, a form of dystrophic calcification. This is an outstanding picture by Dr. Paul Stromberg, and showing this sort of reddish, inflamed, angry-looking parts of the skin, usually the neck and the back. And the true mechanism of this dystrophic calcification, which is known as Enosis Cutis, is not totally worked out. It's thought that it may result in a change in the tertiary structure of collagen in the skin, predisposing it to calcium deposition, but nobody really knows. But it's a very characteristic, both histologic and gross picture in the dog. Histologically, or under the microscope, you are going to see anything from sort of a light dusting of mineral to large areas of mineral, and some animals will actually progress to osteoma cutis, where you get these large areas of bone-like mineralization in which marrow can be apparent. And these are obviously very chronic cases. So Enosis Cutis, a very characteristic lesion of hyperadrenocorticism in the dog. And I use the term Enosis Cutis. Don't get that confused with Enosis Circumscripta. This is a great, very old picture of Enosis Circumscripta. Enosis Circumscripta is another form of dystrophic mineralization and resulting granulomatous inflammation. What you see in the dermis, often in areas over pressure points or areas of buried suture or repetitive trauma, is the accumulation of large lakes of mineral which are surrounded by granulomatous inflammation and fibrous connective tissue. Often seen in young, large breed dogs, including German Shepherds and Great Danes. And histologically, you just see these beautiful lakes of mineral surrounded by granulomatous inflammation. Can also be seen in the tongue. And some of these lesions, when they are seen in puppies, will stop growing, interestingly enough, at the time of physeal closure. They'll grow along with the physes and then they'll stop growing. But it's an interesting lesion. It can be readily diagnosed on cytology as well, but eventually you want to excise something like this. Enosis Circumscripta. Don't confuse with Enosis Cutis, two very different entities, and which mean very different things for the future of the dogs. And this is never going to do much of anything, but Enosis Cutis, obviously that animal needs to be treated probably for a pituitary neoplasm, or maybe in about 20% of cases, a neoplasm of the adrenal cortex. We talked a little about myxedema, and myxedema is also a normal finding in the skin of certain animals, such as Shar-Peis. It gives them that saggy, baggy face. And so you'll always see a little bit of myxedema. And cutaneous mucinosis may be seen in these dogs. There's a great picture by Paolo Roccobianca. And you may see it in these dogs. You may see it in some Cocker Spaniels. And it may be, as we said before, a manifestation of certain endocrinopathies like hypothyroidism. But these little sort of bulges from the surface are just excess ground substance within the skin. Since we talked about Shar-Pays, and now I'm just going off on tangents and making connections here, but here's a absolutely fantastic picture of a condition that is seen in Shar-Pays, generally as a result of infection with Streptococcus species, including Streptococcus canis. It is known as streptococcal toxic shock syndrome in Shar-Pays, or just toxic shock syndrome in Shar-Pays, and it is a generalized vasculitis and sepsis which manifests severely in the ventral abdomen and the legs, and just associated with strep sepsis, this vasculitis. So it's a Shar-Pays thing, as well as the normal cutaneous mucinosis. Here's a great picture by Dr. Grandi, which I had never seen before it showed up in Noah's Archive. And this is a condition, it's probably not all that important, but this is a disease. It's a disease, I'm probably overusing that term. But it's a condition which is seen in miniature schnauzers, and it's called the Gilding Syndrome. To gild something is to sort of paint it gold, so the Gilding Syndrome of miniature schnauzers. It's a great idiopathic condition which is associated with a color code change from their normal salt and pepper to a gold coloration. And usually it starts out in the young animals, but you can see it in the middle-aged animals as well. Not always associated. Miniature schnauzers have a lot of skin conditions, but I thought this was a good one. The Gilding Syndrome of miniature schnauzers. It's also known as acquired auro, A-U-R-O, trichia. That's, I guess, gold hair coat change of miniature schnauzers. That's a fun disease. Our last non-quote-unquote neoplastic disease, but I'm going to lump some of the follicular cysts in there, is one that is seen in a lot of different breeds of dogs, and I have had the unfortunate experience of having 2 dogs in my life that did this, and this is one of them. It's not my dog, but it certainly could have been. This is from a Doberman, and this is an acrylic granuloma. Dobermans are sort of high-strung dogs, and they will tend to self-traumatize. And my particular dog would lick and lick and lick on the forearm, and we tried everything. Eventually, he got down into the joint, and we had to amputate the leg, and then he started on the other leg, and finally we just had to put him down. I also currently have a golden retriever who will do this from time to time when left to her own devices. Not really too bad, but so acrylic granuloma, anything that you see on an area that an animal can get to, the biopsies, you tend to have a lot of granulation tissue with vessels oriented perpendicular to the ulcerated surface. But a lot of them don't have it. Another great example of why gross images are so important in dermatopathology, and they're so helpful. So acrylic granuloma. Okay, so moving on. 53 minutes, and we're just now starting the neoplasm and neoplastic-like lesions. Okay, let's drive on. Thank you, Jim Carpenter, for taking a picture of this. No one ever takes a picture of these. It's a skin tag. It's an acrocordon. There are probably some other names for this. I usually call these acrocordons. And you see acrocordons, they are sort of pendulous, finger-shaped projections of dermal collagen covered with often a hyperplastic epidermis. There are no adnexa in it, no hair follicles, nothing but collagen and overlying epidermis. If you see hair follicles or something, it's not an acrocordon. I like to call those lesions, and a lot of times you'll see some disordered proliferation of sebaceous glands and follicles, and I usually call those nodular dermal fibrosis with fibroadnexal dysplasia. That's mine. Some people call them hamartomas. There's all sorts of names out there. But remember, no adnexa in a simple acrocordon. Now, one of the most common things that we see in our surgical pathology practice are cysts and neoplasms of the hair follicles in the skin. They can be very difficult to identify grossly, and that's why God made microscopes. But your typical follicular cyst, whether you call it an isthmus cyst or a matrical cyst or whatever, the cysts tend to have lamellated keratin. Sorry, I just took off for rounds. I just came back, so I lost my train of thought. Lamellated keratin within them. But if these ended up being tumors, okay, I could live with that too. But I like the way that the keratin goes around, so I picked this picture. When you get to the follicular tumors or the basal cell tumors, here's a great picture of a follicular tumor by Raquel Rich of Texas A&M. The keratin tends to be more granular. It doesn't have the concentric layering. Now, could this be a trichoblastoma or a trichoepithelioma or even a pilomatricoma? They can be very difficult to tell grossly. Here's one that you can tell grossly. This is one that is connected to the surface of the skin by a pore. There's some little keratin pearls within the wall. This is an infundibular keratinizing acanthoma. This has gone through a number of names. I have to remember which one is in current use. It used to be intracutaneous cornifying epithelioma. Now intracutaneous keratinizing acanthoma. And they always have this pore. People like to squeeze them, and they get stuff to shoot out the top, and everybody's excited. Unfortunately, in a lot of cases, they don't get the stuff, and it squirts out the side. And when these follicular tumors, because they have a lot of keratin in them, rupture because of trauma, then you get a lot of granulomatous inflammation, and it jumps from a centimeter to a centimeter and a half or 2 centimeters because of the inflammation. It becomes painful. So bottom line, don't squeeze stuff to get goo out of it. You're not helping the dog, and you're possibly making a okay situation into a very unfun situation. This one was a pilomatricoma. These have abrupt keratinization. If you look at them under the microscope, they're usually one big cystic-like mass. But just look at this one. You don't have a pore. It's sort of a granular type of arrangement of the keratin which is within it. So I think I would lean toward tumor on this one, but you can't tell the difference from one follicular tumor to the next based on growth. We don't do that. This is fun. We looked at papillomas earlier, and sometimes papillomas will give rise to these large horny-like proliferations of keratin, and they're called cutaneous horns. You can see them singly, you can see them multiple. I tend to see them on the feet more than anywhere else on the dog, but they often arise from papillomas and may be associated with papillomavirus. As we look at the common skin tumors, this is one that over the years has been called a raspberry tumor or a strawberry tumor. It tends to be single. It is elevated. The surface is often ulcerated, and on cross-section you can see that it does not pretty well demarcated from the underlying dermis. It does tend to have these extensions, probably along adnexal structures. This is a canine cutaneous histiocytoma, very common neoplasm of dendritic cells of Langerhans in the skin, and they tend to regress over time. Although it is the bread and butter of very many pathologists who read biopsies for a living, because people take them off, and you probably left it alone, it would have gone away on its own. Mostly young dogs, mostly dogs less than 2 years of age. Occasionally you'll see them in older dogs, and they tend to hang around a little longer. This is one that you can see that the neoplastic cells go into the overlying epithelium occasionally, or the follicular epithelium, and it really doesn't impact on prognosis at all. I used to think, boy, if something invaded the epithelium, it's got to be a T cell. But over the years, we've seen more and more different tumors occasionally migrate into the epidermis, and it doesn't really mean anything. But contrast that with this particular neoplasms. It's multiple It blends somewhat imperceptibly with the skin, and the reason we can't see delineation is all this skin is really ooey and gooey and edematous, and this is what you would expect with mast cell tumors. There's so much going on right now with the histologic diagnosis of mast cell tumors. The 1984 Patnick schedule has been largely replaced by Kupel's 2011 schedule, or grading system, which divided them into high grade versus low grade. I think that it works very well in my particular practice because most of my reports go back to practitioners. If you are sending reports to a veterinary oncologist, you may want to use the more recently espoused grading system, which was put forward by the ACVP working group, which incorporates both the Patnick system and the Kupel system. So think about your audience. We do here recommend at the JPC on all high grade to potentially look at certain markers available through Michigan State University to help to delineate future behavior by these high-grade tumors, including looking for exon or mutations in the DNA of some of these tumors, which helps to predict which ones are going to be bad actors and are associated with a decreased survival time. However, obviously the caveat needs to be made that these low-grade tumors can metastasize and act badly as well. A certain percentage are going to look very benign and going to act very badly. So we preface all of our letters here at the JPC that all mast cell tumors must be considered potentially malignant. Well, this is two things. This is a great picture of a transmissible venereal tumor and also a great advertisement for wearing gloves. Now, I don't think that you're going to get a transmissible venereal tumor from a dog, but I just think gloves are a good thing when you're handling the genitalia of an animal species with any particular obvious neoplasm. My own personal bias. Okay, so transmissible venereal tumors, we don't see them too much in the U.S., but occasionally we do see them. It is a neoplasm which undergoes xenotransplantation. There are very few of these tumors generally can't be transplanted from one animal to another. This one obviously can. It has 59 chromosomes, which is an abnormal. It's thought to have derived from a specific genetic alteration of canine histiocytes, and the neoplasms during the growing phase don't express any type 2 major histocompatibility antigens, but then over time will. So eventually, it helps them transplant from one animal to another, but eventually as they begin to express the type 2 major histocompatibility antigens, then they will usually engender an immune response, and they will regress. You can see them on the genitalia of the dog. You can also see it on the nose or on the face of dogs, and then occasionally you will see them widespread within either skin or even sometimes to various organs of dogs, probably dogs that are somewhat immunosuppressed. There's a great picture by Dr. Sawangkastan Sakanwat from Thailand showing metastatic transmissible venereal tumor, not a common occurrence at all. Another neoplasm of the skin of the dog is T-cell epitheliotropic lymphoma. Has gone under a number of names, including mycosis fungoides. Some cases, certain instances, people use the term pagetoid reticulosis. It's a neoplasm of T-cells, sort of bizarre-looking T-cells. On ultrastructure, they have this sort of cerebriform, weird nuclear appearance. But the key is that these are T-cells. While the majority are in the dermis, you will see little packets of them within the epidermis of both the overlying epidermis and the follicular epidermis, occasionally even the apocrine glands, and these are known as Poirier's microabscesses. And the interesting thing about this, sometimes there'll be a single nodule, but a lot of times it's multiple nodules. They're raised, they're red, and they're erythematous. And very interestingly, this is a picture that was given to me by Dr. Guillermo Couto a number of years ago, and he said, you pretty much always, if you look at these animals, You can tell grossly because you'll see these donuts, little areas where the center seems normal, and the tissue around that is inflamed and has these lymphocytes. And over the years I've looked, and I think he's right. Over time, here's one in a schnauzer, and you can see these donuts, and a lot of times you'll see that. So I always look for that in case I see it, and that might help me at least grossly lean toward a diagnosis of T-cell epitheliotropic lymphoma. Once again, biopsy, biopsy, biopsy. You don't want to make a diagnosis of that on a gross picture, but that's what we're doing here. It's gross pathology. So then we do. Oh, here's one more I found. Donuts. Look at the donuts. Okay. So that's not my own. I always want to say that's not my own original idea. That's Dr. Guillermo Couto, and it's worked out more often than not over the years. Okay. It's a Bernese mountain dog. 33% of Bernese mountain dogs are going to develop one of a spectrum of histiocytic disorders, which go by the name cutaneous histiocytosis, systemic reactive histiocytosis, and malignant histiocytosis, which has now become synonymous with the term histiocytic sarcoma. It's not all restricted to Bernese mountain dogs, but certainly they're the ones that are best known for this. And it's a disorganized proliferation of dendritic cells and T cells, and the names are very descriptive. Cutaneous histiocytosis is pretty much restricted to the skin, to the lymph nodes, but they also do have an ocular predisposition. No, I'm sorry, I got that wrong, and rather than go back in it, I'm just going to say, no, cutaneous is just skin, and systemic reactive histiocytosis goes skin, lymph nodes, eyes, and as we see here, the nasal mucosa. So this dog has a systemic histiocytosis, but it doesn't go to the viscera, and the cells are pretty bland-looking macrophages or histiocytes. They're really dendritic cells, so they're histiocytes, not macrophages. And then the variant that used to be called malignant histiocytosis, they get bizarre-looking. They have pleomorphic nuclei, and they end up in the viscera. And now those have been reclassified pretty much as malignant tumors, histiocytic, a disseminated histiocytic sarcoma. So cutaneous histiocytosis, systemic histiocytosis giving you eye and nasal mucosa, and then the histiocytic sarcoma, pleomorphic cells involving all of this and multiple organs as well. Hey, it's a big bloody tumor, hemangioma. Vast majority. Often these are associated with UV damaged skin. You see these pop up, and the less common hemangiosarcoma in the glabrous skin of dogs, especially light-colored breeds. And they often show up on the belly, and people think, it's because these animals are sunbathing, and some animals do like to lay on their back in the sun. But if an animal is kept in bright sunlight on concrete, that will tend to reflect enough UV light up onto their abdomen, and if they are a predisposed breed, and we see a lot of these in pit bulls, they may develop UV-induced vascular tumors. We're looking at the south end of a northbound traveling dog. We're looking around the anus, and this is the location here and here of the perianal. I shouldn't call them sacs. There are the perianal glands, but we shouldn't call them glands. They are perianal sacs. There are apocrine glands within them, which sort of give it, along with a number of other things, including some slough skin, but they're not really glands. They are the anal sacs. But what we see are a number of modified apocrine glands around the anus, which often will give rise, especially under the continued pounding of testosterone. So we see them most commonly hyperplastic lesion and neoplastic lesions, most commonly in uncastrated male dogs, but you can see them in female dogs. You can see them in neutered males, neutered females, and they don't only sort of these modified modified sebaceous glands, I think I said apocrine, but modified sebaceous glands don't only sit around the anus, they tend to go along the midline, the dorsal midline, and the ventral midline. So you can see these perianal gland neoplasms come from the lumbar, skin of the midline. They are modified sebaceous glands. The vast majority will operate in a benign fashion. There are lobules of cells, we call them hepatoid gland cells because they look a little bit like liver, but it's a terrible name because they have nothing to do with liver. But most of them are just aggregates of well-defined lobules with a thin rim of reserve cells at the edge. In a low number of cases, we see low-grade malignancies and very rarely real malignancies of these tumors. I think when they tend to get traumatized, they tend to get somewhat disordered, and you get a higher increase in mitotic rate of the reserve cells, and they sort of mixed into the lobules, and we often will call those a low-grade carcinoma. That's more for coverage, because I think most of those act in a benign fashion. So perianal gland neoplasms, don't call them hepatoid tumors. Let's stop with that particular appellation. Now, the real bad actors of the anal sacs, the paired anal sacs, are tumors that arise from the apocrine glands that live in the wall of that sac. We call these apocrine adenocarcinomas of the anal sac. I don't think I've ever seen a benign one. And these tend to metastasize early and widely. So by the time the animal develops a perianal mass, often you have metastasis to the sublumbar lymph nodes and maybe even beyond. They're beautiful neoplasms that form a lot of rosettes. They occasionally will result in systemic hypercalcemia as a result of their production of parathyroid-related protein and subsequent stimulation of hypercalcemia. And this is a guarded prognosis at best. These are bad actors which metastasize widely. I could have shown you a regular old lipoma, but everybody knows what a regular old lipoma looks like, I hope, because they're very, very common in dogs, usually confined to the skin. One tip: a lot of people will look at these tumors grossly and feel them on the dog, and they're sort of squishy, and they're not really anchored to underlying tissue. And the vast majority, those could be lipomas. But what is sneaking around, masquerading as lipoma, are soft tissue sarcomas, and sometimes it can be very difficult grossly to tell the difference between soft tissue sarcomas and lipoma. So I strongly advocate anytime you see a lipoma, aspirate it. Make sure that you don't have a soft tissue sarcoma. But let's get back to the lipoma. Everybody knows what the regular lipoma looks like, but don't forget, lipomas come in other flavors. We have infiltrative lipomas, which will infiltrate skeletal muscle and even can go into bone. They're often seen in Dobermans and Labrador retrievers. You can see them anywhere, and they're not associated with obesity. They are an infiltrated neoplasm. They're not liposarcomas because these are well-differentiated adipocytes, not adipocytes, people, adipocytes. There's only one way to pronounce that word. And so they infiltrate and replace skeletal muscle, and it looks just like a regular old lipoma. There's another form that you'll see in the hind limb of dogs, which are intermuscular. These don't infiltrate the muscle bundles itself, but they get down in between the individual muscles, especially of the quads, of the quadriceps femoris, those semimembranosus, semitendinosus complex. They will dissect in between, and those are the devil to get out. You can't really go in there and excise them surgically. So remember, multiple different types of lipomas, not to be confused with liposarcomas or hibernomas, which are rare tumors of brown fat, which you almost never see in the dog. Oh, I guess this is a tumor of the skin, but it's a toe. And when we think about toes, we think about a couple of things. We're going to think about, in dark-coated breeds, we're going to think about melanoma. Melanoma is a bad thing to see in the toe like it is in the oral cavity. Maybe not quite as bad, but melanomas of the toe tend to be a bit more aggressive. But this one, is a squamous cell carcinoma. We do see squamous cell carcinomas of the toe, and they may be associated with UV induction, or they may simply be previous papillomavirus infection. So both of those have been theorized and identified as causative agents for squamous cell carcinoma of the toe. They can be very aggressive here too, metastasize to lymph nodes and lungs. And I'm not mentioning apocrine tumors. Apocrine tumors, especially of the extremities, are very aggressive in the dog, go to lungs, and we've had a number of military working dogs with these metastatic apocrine gland carcinomas, go straight up the lymphoid chain and into the lungs. So watch out for some of these adnexal epidermal type of tumors, especially in and around the feet. We're getting close to the end. Is a very interesting, and our last entity is a very interesting lesion that can be seen in German Shepherds and German Shepherd mixes. And these are areas of nodular dermal fibrosis, not particularly a neoplasm per se, but there are these areas of very bland fibrous connective tissue, and they've been identified in an interesting triad of nodular dermal fibrosis, smooth muscle tumors of the genital tracts in females, give or take, and renal carcinomas in German Shepherd dogs. And so male German Shepherds are only going to have the renal carcinoma, obviously, and the nodular dermal fibrosis. So it's an interesting connection. It hasn't been quite worked out yet. Seen a couple of those over the years in the military working dogs here at the Joint Pathology Center. Just another picture right here of nodular dermal fibrosis in the German Shepherd dog who turned out to have a renal cystadenocarcinoma. Well, let's not blab anymore. It's been an hour and 15 minutes. Thank you for hanging in there. I hope you got a couple of little pearls out of this one. Our next lecture is going to be the musculoskeletal system. I promise it'll be much shorter. Hey, thanks for hanging in. Be sure to come back to the Foundation's Facebook page or the Joint Pathology Center's video library for more lectures on gross pathology of the dog and other species and systems. Thanks so much. I'm wishing you good health and a great day.